Peace be upon you and God's mercy and blessings. Yesterday, a patient came to me crying, saying that her mother is admitted to the ICU and they want to perform something called a tracheostomy. They are asking for her consent to do the tracheostomy operation for her mother, but she doesn't really understand what it is. Why are they requesting this tracheostomy? And what are the problems? How will they do it? And what complications might happen afterward? She was extremely distraught. Look, first, what does a tracheostomy mean? A tracheostomy is something, well, we know that if a person needs us to help them breathe, we can insert a tube through their mouth or nose, which goes down the throat, passes through the larynx and reaches the trachea. That means a tube is inserted starting from the mouth or the nose, passing through the larynx and entering the trachea so that we can deliver air from the ventilator to the person's lungs to keep them alive. We absolutely need this in surgeries that require general anesthesia because the person can't breathe on their own during that time. These are the tubes that we normally use and everyone knows about them. They're called anesthesia tubes. But what does it mean to insert a tube here, open the skin, and place the tube directly into the trachea instead of through the mouth or nose, and open up below the larynx? I insert it directly into the trachea. And this tube will have its opening in the skin of the neck here, with the tube going into and reaching the trachea. When do I need to do this? For example, like the lady who asked me yesterday when she said they're requesting it for her mother who is admitted in the intensive care unit. This is one of the most common procedures done, a tracheostomy, which is performed for patients who are admitted to the intensive care unit. Those who have a laryngeal tube inserted, meaning the tube is placed through the mouth or nose, and it has been there for a long period, like more than 2 weeks, and they need a ventilator with this tube in their mouth or nose. After 2 weeks, in adults who still need ventilation and the tube remains in place, we don't like to leave it for more than 2 weeks. Why is that? Because this tube passes from our mouth to the larynx, and the larynx contains the vocal cords. This tube is made of plastic, and when it goes inside the vocal cords like that, with coughing and with it staying in for a long time, it's possible that after the patient recovers and we remove the tube, the larynx could be damaged. It could injure the vocal cords. This friction can harm the vocal cords and also cause narrowing of the larynx. So to avoid damaging the larynx later on, and also to make it easier for me to suction chest secretions and remove the mucus from inside the lungs easily. It becomes difficult to suction through the tube that's inserted in the nose, so we make this opening. The purpose of it is to deliver air directly to the trachea without disturbing the larynx with a tube that stays in for a long time. It also makes it easier for us to suction from it. Now, if the patient recovers and no longer needs artificial respiration, this tube can be removed. Yes, it can be removed completely normally, and the skin will close up. The trachea that we open during this procedure will close again, and there won't be any problem. So, do other patients besides those in the intensive care unit on ventilators need this procedure? Yes, in many situations we need it. Sometimes we need it when we're concerned about the larynx during a surgery we're going to perform, for example. If we're doing surgery on the tongue, there's a lot of bleeding in that operation and a large swelling can occur afterward. So we expect that this swelling will block the airway, and as a result, it will be difficult to insert a tube through the mouth. Therefore, sometimes before surgery, the patient might not have any issues, but if they're going to have surgery on their tongue, for example, or surgery in the nasopharynx or behind the tongue, we insert this tube before the operation. Then, when things are stable after the surgery, maybe 3 or 4 days, a week, or even 2 weeks, we remove the tube, let the wound close, and the larynx and skin return to normal. It can also be used as a treatment. Simply put, if there is something like a tumor, inflammation, or a congenital defect blocking the airway so that the person can't breathe properly. And sometimes I can't insert a tube because there's a tumor, a congenital defect, a narrowing, or a problem in the larynx or the vocal cords. The patient could suffocate and we wouldn't be able to insert a tube through their mouth. So the solution is to make this opening here directly. This happens in children. We sometimes need it for kids who are born with a congenital defect, like a problem with the vocal cords, a membrane causing narrowing between the vocal cords or below the larynx, or a patient who has had a tube inserted many times through the mouth which has caused a narrowing in the larynx. So after we tried to remove it, we found that the patient couldn't breathe and we couldn't insert another tube for him. So we make this opening and insert the tracheostomy tube directly. So children with congenital defects before certain surgeries, people who have tumors in the larynx. Sometimes the tumor blocks the airway and we can't insert a tube to get air in, so we are forced to make an opening. All these situations require a tracheostomy, after which the patient might need to keep the tube in place and leave it there. Or the reason might be something we can treat or something that can be reversed. And so once we recover from that illness, that's it. So after we perform the tongue surgery, everything becomes fine, the tumor is gone, and things are back to normal. We remove the tube. If there's a congenital defect in the larynx, we fix it with surgery or another method. We insert the tracheostomy tube until we can do the surgery. The patient breathes well until the surgery is done. Then we remove it once the problem is resolved. So doctor, is this procedure dangerous? A lot of people ask me, is this procedure dangerous? No, honestly, it's not dangerous at all. It's just a small horizontal incision in the neck, then we reach the trachea, open it, and insert the tube. God willing, as long as we don't harm any of the veins or arteries in the neck while performing it, then it's just an incision and a tube inserted. Nothing dangerous while we're doing it. So doctor, you're going to make an opening here. Then when you remove this tube, it will close up and heal completely, and this opening won't stay open. Yes, after we remove it, it closes up and there's no problem. And if it doesn't close, we have a way to close it, okay? But still, I'm not convinced, doctor. When I spoke to the woman who came to me yesterday and explained this to her, she said, but how will he speak? Look, in order for us to speak, it has to pass over the larynx, especially when the air is coming out. For us to be able to speak, the air inside our chest has to come out, and as it comes out, it passes over the larynx. But when we put a tube down here, the air as it comes out doesn't pass over the larynx. It goes straight out, so the person really can't speak. So if we want them to speak, what do? Look, if the situation is temporary, he can block the tube with his finger like this and speak. That is, he breathes in through the tube, and when he exhales, he can block the tube with his finger so the air passes over the larynx and he can speak. So does that mean he has to keep putting his finger there every time to close it? Yes, that's if the situation is temporary. But if it's going to last longer and the patient has a problem in the larynx or above it that we can't solve and the tracheostomy tube will stay in permanently, how will he speak then? There is a valve. Sometimes the tube comes with a valve like this, a voice valve, when our plan is for the patient to stay on the tracheostomy tube for a long time because we can't solve his problem. So we will insert the tube that has this valve. This tube with the valve allows air to enter normally, but when it comes to exhaling, it blocks the air, forcing it to pass through the larynx and come out, allowing us to speak. So can this voice issue be resolved? Yes, it can be resolved. Okay, what else could be a problem caused by this tube that we can't solve? And what issue might someone who has had the tube for a long time complain about? He complains that he does not know how to go to the sea. They can't shower properly because water is not allowed to enter. The water could get into the tracheostomy tube, because if it gets in, it goes directly to the lungs. When water enters through our mouth or nose, the larynx closes and doesn't let it reach the lungs. But when I have a tube placed below the larynx, which normally protects the entire respiratory system, if water gets in, it goes straight into the lungs and causes problems. And the person coughs, chokes, and things like that. There isn't really a strong solution for this, other than making sure the patient doesn't go into a swimming pool or the sea while bathing. He just needs to take precautions so that no water gets in, and we wish him a speedy recovery. May God spare us from illness, and may we never need to have a tracheostomy, and if we ever do, God willing, we'll be able to close it up again. May the patient get well, and may God heal every sick person. Wishing everyone a speedy recovery. If you like these videos, please give them a like and subscribe to the channel so we know you want more videos from us.